Okay, Miss Keller, if you could tell us from your notes yesterday, what was that voice that came over the airplane from the White House Situation Room that came on every 30 seconds? What did it say? Yes, please. Right, wayside standby. And what they were doing is they were, again, waiting on that airplane full of cabinet members to see the condition of the president. And for the next several minutes, every 30 seconds it would come on wayside standby, wayside standby. And we'll talk more about that in a minute. So here's where we're at today. The presidential motorcade, which had been racing 77 blocks to Parkland Hospital from Daly Plaza, finally reached Parkland at 12:36 p.m. So the presidential limousine with the stricken president reaches Parkland Hospital at 12:36 p.m. And one of the men who witnessed the president's arrival was Dallas Trooper Milton Wright, who's on your ID sheet. So one of the men who witnessed this scene of the president arriving at Parkland Hospital was Dallas Trooper Milton Wright. What's a trooper, by the way? Like a highway patrol, so to speak. Now, Milton Wright was not on his own. He was actually riding in the fourth car of the motorcade with Mayor Cabell and his wife. So the fourth car in the motorcade contained Dallas Mayor Earl Cabell and his wife, and Dallas Trooper Milton Wright was also in the fourth car in the motorcade. And that it was kind of interesting because a lot of the motorcade followed the president's limousine to the hospital because they really didn't know what was going on. They must have had some sort of an idea. Now the whole thing didn't follow, but several did, including the car that Mayor Cabell and his wife were in and Milton Wright. Now, when Wright got out of his car, he was actually asked to help lift wounded Governor Connally out of the limousine seat and into the hospital. So Milton Wright, when he got out of the car at the hospital, he actually helped lift wounded Governor Connally out of the presidential limousine and take him in the hospital. He didn't take him in, but he helped lift him out of the limousine, and then he was taken into the hospital. So Connally goes into the hospital prior to the president going in, okay, when they stop. Now this is what Trooper Wright was later quoted as saying about his experience there. He said, "As soon as we got him," meaning Connally, "out, a Secret Service guy ran up in the car and pulled the president over to one side. I could see partially the side of his head was gone." This is the massive wound that the president has. Now, once Wright helped get Governor Connally out of the limousine and they took him into the hospital, they asked Trooper Wright to help put President Kennedy on a gurney. And that's what he did. He helped put the president on a gurney, and then he stood outside the hospital guarding to make sure that unauthorized personnel did not get in. So when we go back to Milton Wright, I'll repeat it again. He was one of the witnesses when the presidential motorcade reached Parkland Hospital at 12:36. He was a Dallas trooper. He was riding in the fourth car of the motorcade with Mayor Cabell and his wife. Once they got there, and he got out of his car, he was asked to help lift Governor Connally out of the presidential limousine so they could take him into the hospital, meaning that Governor Connally actually went in before the president. He was later making the quote that I stated, and then he was asked to help put President Kennedy on the gurney that would take him into the hospital, and then he stood guard outside. Okay? Now Milton Wright is this fellow right here. There's several of these people that we're talking about. You can come up and look up on the wall here, but this is Milton Wright right there. Now, it took some time for the president to be removed from the limousine because Mrs. Kennedy was protesting him being taken out. She was very livid. She didn't want him taken out of the limousine. And Clint Hill kept trying to say to her, "Mrs. Kennedy, we've got to take him in. Mrs. Kennedy, we've got to take him in." And Jackie refused to allow Agent Hill to take her husband into the hospital. And he just pleaded with her, saying, Mrs. Kennedy, we've got to take him in." Now, why do you think Mrs. Kennedy wouldn't let them take her husband into the hospital?
Because she didn't want people to see.
Very good. she didn't want the people to see the massive head wound. It was gross. And Clint Hill finally figured that out. And when he figured it out, he took off his sport coat, got into the limousine, covered the president's head with his sport coat, and then Mrs. Kennedy let him take him in. So very good, Taylor, and whoever else chipped in there. Not a lot of kids ever say that. So Hill finally realized the problem. He took off his sport coat, he covered the president's bloody head, and Mrs. Kennedy allowed Clint Hill to remove the wounded president and take him into the hospital. Now, a witness to that was a nurse by the name of Phyllis Hall. And she was the one that was asked to go get the gurney to put the president on. So she stood there after bringing the gurney up to have the president put on and witnessed this discussion between Clint Hill and Mrs. Kennedy and her refusal to let him take the president in. So she sat there and watched that whole thing. Okay, and she'll come back into the picture a little bit later. So another witness to that particular event was Nurse Phyllis Hall, and she was the one that was asked to obtain a gurney for the president. Here's a picture of Phyllis Hall right here at the time in 1963. And she'll come up in an interesting discussion in a bit. Now, another witness that was there at Parkland Hospital was Senator Ralph Yarborough. Remember him? He was riding with the Vice President and Mrs. Johnson for orders of President Kennedy. He also was at Parkland, Senator Yarborough. And this was the quote he made later about what he saw. This is Senator Ralph Yarborough. He said, "The minute the car stopped, the Secret Service rushed at Johnson and formed a corridor around him. I heard one of them say, 'Mr. President,' to Johnson, and at that point, I knew Kennedy was dead." So somebody went up, the Secret Service, he described the Secret Service going up to Johnson, circling him for protection and referring to him as Mr. President. Okay? So that's the end of that subtopic. What we're going to go to now is events at Parkland Hospital. What exactly happened at the hospital? The president is now been placed on the gurney and taken in the doors of the hospital. Governor Conley's already in there. Okay? Events at Parkland Hospital. Well, Kennedy was rushed into Parkland Hospital into an emergency room now known as Trauma 1, which is on your ID sheet. So Kennedy was rushed into Parkland Hospital and into an emergency room labeled Trauma 1. So the president was rushed into Parkland Hospital and was taken into an emergency room at the hospital known as Trauma 1. And the first physician to see the president was Dr. James Carrico. Dr. James Carrico was the first physician to see the president when he was brought in. Dr. James Carrico. He was just 28 years old. Very young doctor. So the first physician to see the president was Dr. James Carrico, who was just a 28-year-old physician working at Parkland Hospital. And he examined the president and he reported these four things. So Dr. Carrico examines President Kennedy and he reports these four things. Number one, he reports a small wound of the anterior neck in the lower 1/3. We'll explain that. He reports number one, a small wound of the anterior neck in the lower 1/3. What does that mean? A small wound of the anterior neck in the lower 1/3. Where's your anterior? Your front, okay? So he reports that wound, okay? He doesn't say whether he thinks it's an exit or entrance wound. He just reports it. So he reports a small wound on the anterior neck in the lower 1/3. Number two, he reports a wound that shredded the brain tissue which had profuse oozing. Okay, he reports one wound that shredded the brain tissue which had profuse oozing. One wound that shredded the brain tissue which had profuse oozing. basically what's happening is that you're having brain matter and tissue oozing out of the president's head. Gross as that sounds, but we have to make the point. Third thing he reported is he had no pulse or blood pressure present. No pulse or blood pressure present. No pulse or blood pressure present. And the fourth thing he reported that the president's pupils were dilated and fixed. The president's pupils were dilated and fixed. So he reports one small wound of the anterior neck in the lower 1/3, which is the neck wound. He reports one wound that shredded the brain tissue which had profuse oozing. He reports no pulse or blood pressure present, and the president's pupils were dilated and fixed. What's basically he reported? That he's dead, but we got to hang tight. Now, assisting Carrico was Dr. Don Curtis. It was his first year as a physician. First year as a physician. And he was assisting Dr. Carrico, and he actually was the one that unbuttoned President Kennedy's bloody shirt and witnessed the bullet wound in his throat. He was probably the first one to witness the bullet wound in the throat, Dr. Don Curtis. He was in his first year as a physician, and he assisted Dr. Carrico in doing this report by unbuttoning President Kennedy's bloody shirt. Here's a picture of Don Curtis right here. He later went on to become a dentist. And some people think that this scene that he put himself through convinced him maybe dentistry was his way to go. So Dr. Don Curtis was a first-year physician at Parkland Hospital. He assisted Dr. Carrico, and he's the one that unbuttoned President Kennedy's shirt and saw the bullet hole in his neck. The next surgeon that examined the president was Dr. Malcolm Perry. Dr. Malcolm Perry, 34 years old. Dr. Malcolm Perry. This is a doctor you hear more about. Here's Dr. Perry right here. This is a very tough signature, by the way. Dr. Malcolm Perry. And what he did, with the help of Dr. Robert McClellan, performed a tracheometry, I can't say it very well, tracheometry in an attempt to improve the president's breathing. So where did he perform the trach? In the throat. And conspiracy theorists go crazy because they weren't thinking about conspiracy, or they're thinking about trying to save the president's life. So where did he perform the trach? Right over the wound, right over the bullet wound. So there was no evidence, you screwed up the evidence there, so to speak. It couldn't be determined whether it was an entrance or exit wound because some conspiracy theorists thought a shot was from the front. Well, when he did the trach over the president's throat and inserted a tube down there, it screwed that up. So the president was examined by 34-year-old Dr. Malcolm Perry. He was assisted by Dr. Robert McClellan. And they performed the trach in an attempt to improve the president's breathing. And again, Perry performed that incision for the trach right over the bullet wound in Kennedy's throat. And Dr. McClellan held the retractor. What's a retractor? Anybody know? Keep the wound open, yep. Well, Perry, after performing the trach, Dr. McClellan, after performing the retractor duties, what did Perry do next? He began CPR on the president. And he worked like crazy. And Dr. Malcolm Perry performed the CPR. And he was able to raise what he medically reported as a semblance of a heartbeat. But the fact of the matter was the president was dead when he went in there. No question. But this is the President of the United States, so what's their job? To try to save his life if they can. Take every simple step they can. Well, while they were doing this, while Perry was beginning CPR on the president, Dr. Ron Jones put an intravenous line in President Kennedy's left leg in the event what? He needed blood. Okay? So another doctor working on him was Dr. Ronald Jones. And during this time that Perry's performing the trach and doing the CPR, McClellan's helping by holding the retractor. Dr. Ronald Jones is establishing an intravenous line in the president's leg in the event he needed blood. He also inserted a chest tube into the president. They were doing everything they can. The reason I tell you this is because even though in their hearts they knew he was dead. They were trying everything they could because he was the President of the United States, and not only is he a president, that's their job, is it not? To try to save a life. Well, who do you think comes in the room at this time to evaluate the president's condition? Who's going to have to make some decisions on what to do here if the president dies? Not Mrs. Kennedy, they kept her out. We'll talk about her later. No, they got him in another room because they don't know if this is a conspiracy to kill the entire head of the government. They got him protected in another room. So who's in charge of the Secret Service in Dallas? Who's in charge of the whole thing? One of the drivers of the limousine, Roy Kellerman. So Secret Service agent Roy Kellerman comes into Trauma 1 at this time to try to evaluate the president's condition. So Secret Service agent Roy Kellerman goes into Trauma 1 while Perry, McClellan, Jones, and Carrico, Curtis, all those doctors are in there working on the president, and he's trying to figure out the president's condition. And once Kellerman saw the severity of the president's wound, he hollered out to agents to get a telephone line to the White House immediately. So as soon as Kellerman saw the condition the president was in, he ordered other agents to get a telephone line so he could speak with the White House, or somebody could speak directly to the White House immediately. Okay? So Agent Kellerman comes in, sees the severity of the president's wounds, and orders other agents to secure a line, a telephone line to the White House immediately. The Secret Service agent that secured the line was Clint Hill. Clint Hill is the Secret Service agent that secures the line. So he secures the line, Clint Hill does. He's talking to the White House in Washington, and all of a sudden the operator interrupts the conversation, and guess who's on the phone wanting to talk to Clint Hill? So he's talking, think about this, he's talking to the White House, he's explaining what's going on in the White House. All of a sudden the White House operator comes on and says, Mr. Hill, I've got a call from so-and-so. Who do you think that so-and-so was? No? What? Who wants to know what's going on? Robert Kennedy. Bobby Kennedy's on the line. So Clint Hill secured the line. He was talking to Washington in the White House on the telephone. He was interrupted by the operator, and the operator stated to Clint Hill that the Attorney General Robert Kennedy was on the phone and wanted to talk with him immediately. So the operator cut through and put Robert Kennedy on the line. Now this is the conversation between the two. You don't have to write it down, just listen. Robert Kennedy didn't get into a lot of details. He simply asked Hill, how bad is it? First thing he said to Clint Hill, how bad is it? Because he's gotten the reports that his brother's been shot. And he says, how bad is it? Clint was later quoted as saying this, I didn't know what to tell him. I really didn't know what to say. I simply said, it's as bad as it can get. That was his response to Bobby Kennedy. It's as bad as it can get. Well, we're talking about Mrs. Kennedy. Where's Mrs. Kennedy during this time? She's outside the trauma room sitting in a simple wooden chair. And a Dallas police sergeant by the name of Robert Bob Duger, who was sitting near the First Lady, was later quoted as saying this. This is Dallas Police Sergeant Robert Bob Duger, who was sitting outside in the vicinity of Mrs. Kennedy, was later quoted as saying this about this experience of seeing her out there. And again, you don't have to write these down, just kind of get the gist of it. He said, she asked me if I had a cigarette, and I said, I'm sorry, but I don't smoke. She said, I have some cigarettes in my purse. Will you get them for me? One of the Secret Service guys came over and said, get your hand out of Mrs. Kennedy's bag, and she put him down pretty quick. So can you imagine that? Can you imagine sitting out there, Mrs. Kennedy, who a lot of people didn't know smoked because she didn't do it too outwardly. But she asked if he had, Sergeant Duger had a cigarette. He said no. She said, I have some in my purse. Would you get one for me? He starts to get into her purse, and the Secret Service jumps on him, and Mrs. Kennedy then jumps on the Secret Service for jumping on him. Okay? You can just imagine something like that happen at the moment. Well, Dr. Perry gave the CPR for what seemed like forever, and it was very obvious that the situation was hopeless. And finally, Dr. Kemp Clark intervened. And the reason he intervened is he was the chief of neurosurgery. He was the boss of these physicians. And he stepped in the room, Dr. Kemp Clark, chief of neurosurgery, and he stated to the doctors in the room, quote, "It's time to stop the resuscitation. This is incompatible with life." So it will be Dr. Kemp Clark that will make the decision to stop the treatment on the president by saying it is time to stop the resuscitation. This is incompatible with life. So it's Dr. Kemp Clark that makes the decision that the president has died. Now, they haven't officially announced this yet, okay? But that was the point in which basically the decision was made the president had died. Now, guess who's standing next to Dr. Clark and Jackie Kennedy? Because Jackie Kennedy came in at that time because they brought her in for that reason. Nurse Phyllis Hall, that we talked about before, that was asked to go get the gurney for the president outside, she's standing next to Dr. Clark and Jackie Kennedy. And she simply turned to Mrs. Kennedy after Dr. Kemp Clark stated his statement and said, "I am so sorry for your loss." So she's right in the middle of history again, inside Trauma 1, standing next to Dr. Clark and Jackie, Nurse Phyllis Hall. And she tells Mrs. Kennedy that she's sorry for her loss. Now, when she was interviewed later about the situation, she basically told reporters that Mrs. Kennedy just stared straight ahead and didn't even appear to hear. She was just in shock. She didn't show any emotion. Well, after that, Hall was asked to go help prep Governor Connolly for surgery. So Phyllis Hall has had quite a role in this. She ends up being the one asked to get the gurney for the president. She witnesses Mrs. Kennedy refusing to let her president come out of the limousine, and what Clint Hill does to get her to let him go in. Okay, she's standing next to Dr. Clark and Mrs. Kennedy when the president's pronounced dead, basically. She